Hello, everyone. Welcome to our webinar today, Busting Myths and Enhancing Support, Advancing Workplace Success for Women. I'm Gloria Blackwell, the Chief Executive Officer of the American Association of University Women, and I will be your moderator for the event today. Thank you so much for joining us. Wanted to start off with just a few housekeeping notes, just to let you know that this webinar will be recorded and will be made available for you so that you can have the opportunity to share it or go back and look again at the content as well. So, just keep in mind that that will be taking place. Also, you can use the chat box if you have any technical questions or something is going on, but use the Q&A feature for any questions that you might have for our esteemed speakers. But I also want to thank those of you who pre-submitted questions. We had a number of questions that we have tried to weave into the discussion, so we hope that you will be able to benefit from that. And we do hope that there will be some time at the end to respond to any new questions. We'll do our best, but we can't promise. Okay. So I want to just start out by talking a bit and framing what we're going to be sharing this afternoon. So, AAUW is an organization that has been advancing gender equity for women and girls for 142 years. We are committed to advancing women's economic security, and we do it through education, through research, and through advocacy. It's on a local as well as a global level. Our member-voted public policy priorities affirm that essential to the well-being of women and all people are an economy that provides equitable employment opportunities, the reduction of poverty, a living wage, quality, affordable dependent care, paid family and medical leave, and quality, affordable, and accessible health care for all, including reproductive health care. Despite common myths that women are becoming less ambitious, we know that women are more committed and driven to success in the workplace than ever. According to McKinsey's Women in the Workplace 2023 report, quote, roughly 80% of women want to be promoted to the next level, compared with 70% in 2019, end quote. And among women of color, quote, 88% want to be promoted to the next level, end quote. We've seen important gains in women's representation and leadership over the past decade, but we all know that there's much more that needs to be done because women, especially women of color, continue to face barriers to advancing their workplace success and their economic security. One significant barrier is a lack of social protections, policies that support advancing work and life, including paid family and medical leave, flexible work schedules, and affordable childcare. The global COVID-19 pandemic shed light on both the critical importance of social protections and where the glaring disparities in access still exist, particularly for women, workers of color, and low-wage workers in the United States and globally. As this year's review theme for the 68th UN Commission on the Status of Women aptly identified, access to social protection systems is key to advancing gender equality and the empowerment of all women and girls. However, according to the International Labor Organization, only 47% of the world's population are effectively covered by at least one social protection benefit, leaving over 4 billion people unprotected. Global Social Security coverage remains lower for working age women than men, and only about a quarter of women are covered under a pension scheme. At the same time, women are paid on average only 80% of what men are paid, and pay gaps in the United States, for example, remain much larger for Black, Latina, Native American, and other women of color. Pay inequities have lifelong impacts on a woman's ability to accumulate wealth, save for retirement, and support themselves and their families. Furthermore, women and girls continue to bear the majority of unpaid caregiving responsibilities around the world. Caregiving responsibilities can pull or keep women out of education and the workforce, with lasting harm to their economic security, especially when they lack access to critical benefits. The United States, for example, does not guarantee paid annual leave, paid time off for illness or family care, or paid parental leave, unlike the majority of developed countries worldwide. The compounding impacts of a lack of social protections, lifelong pay inequities, and unpaid caregiving responsibilities mean that women may be forced to choose between their livelihoods and their health and that of their families. So, in an ever-changing world of work, how can we ensure that policies supporting work and life keep pace with women's ambitions? So let's get started. I am excited to introduce our panelists today, all of whom are connected to our amazing AAUW Fellowships and Grants Program. AUW, this academic year, we are celebrating 135 years of our American fellowships, which started back in 1888. Since our fellowships and grants programs began, AAUW has supported over 14,000 women from over 150 countries around the world. And we are really thrilled to have our three panelists with us today. I'll start with Emilia Brito. She's an economist specializing in the study of gender inequalities. Emilia is currently a PhD candidate in economics at Brown University, and she holds a BA in economics and master's in economic analysis from the Universidad de Chile. Emilia's work focuses on the interplay between the unequal distribution of unpaid care work and gender disparities in the labor market. Additionally, she also studies domestic violence and women's political representation. In her academic career, she's collaborated extensively with policymakers on topics related to gender inequalities. Next, we have Shirpana Ghosh. She's an assistant professor of economics at the University of Cincinnati and a research affiliate at the NIE Center for Studies of Occupational Licensing Regulation. She received her PhD in economics from West Virginia University. And as a trained applied microeconomist, Shirpana focuses on understanding access and barriers within labor markets and health outcomes of underserved communities. She's also conducted research on entrepreneurship in developing countries. Her current project relates to barriers of early screening for breast cancer and the racial disparities regarding breast cancer survival among African American women. And finally, we have Professor Nell Blake. Nell Lake. She is a career journalist who now teaches full-time in Brown University's English department. She received her PhD in American Studies from Brown in 2022, and her research focuses on the gender racialized history and current politics of care and labor in America. As a journalist, she was the author of The Caregivers, a support group's stories of slow loss, courage, and love in 2014, which intimately chronicles 2 years in the lives of unpaid family caregivers. As both a journalist and a scholar, Nell is working on a second book, Mother, Nurse, Housewife, Maid: How Figures of Care Shape American Politics. So please join me in welcoming our esteemed panelists. I'm sure I speak for all of our attendees when I say that we are so glad to have you here and are looking forward to this conversation. Okay, so I have a question, just an opening question for all the panelists. So the question is, how has your work helped to break down some of the myths about factors that shape women's labor participation? Who'd like to start? Maybe Nell?
Sure. Thanks so much, Gloria, for that wonderful introduction. I'm so glad to be here with Emilia and Shriparna and everyone who's listening. I also want to just thank the AAUW for my American Dissertation Fellowship, which was an enormous support, especially it was during COVID, and that made a big difference. Generally speaking, my work focuses on the history of care, caregiving, care labors, and care roles. through my work in American Studies, which is interdisciplinary, and in the humanities, as opposed to the social sciences. So I focus on the history of care and on the enormous need for better care in our society, and the ways in which care burdens historically and still fall on women in both paid work and unpaid work. My most recent project examines the political cultural history of how care and its labors have been racialized, and how this racialization continues to shape American politics and perpetuate inequities. So it's kind of a cultural take on care inequities. I would argue that women's access to and success in the workplace has far less to do with women's aspirations, as you alluded to in your introduction, and far more to do with fluctuations in political culture, and in policy, almost as a result of political culture. Women have historically faced steady political, cultural, and policy headwinds in terms of our ability to gain well-paid work and to meet the needs of family. My research looks at the cultural meanings of care and care roles in America. It challenges myths by unveiling how care is a matter of political struggle and how political actors use traditional care roles to keep women in their place, especially when it comes to how those care roles are racialized. So it's kind of an introduction to my work.
Great. Thank you so much, Nell. Amelia or Shriparna, would you like to offer your take? Start with Shriparna.
Thank you, Gloria, for the glorious introduction, and I'm really, really happy to be here. My work focuses on occupational licensing regulations and its effect on health outcomes and labor market outcomes. So I will just briefly throw some light on how I am targeting to address the gender gap. So women are in multiple professions which are heavily regulated by occupational licensing, as for example, hairstylists, nursing, shampooers, beauty, business, and all of those. So women are affected doubly by being a part of the labor supply, which professions are highly regulated, and also as consumers. So as a mother myself, right, I have to always think of the safety of my children first before I can even go to work. So with the high daycare costs and with the higher occupational licensing regulations, when a woman has to move from state to state for their family migration, right? So there are multiple barriers she has to face while going to work, facing the occupational licensing in multiple ways, because they have to appear for the licensing exams in multiple states in order to start working, and then also pay for the higher opportunity cost of putting their child in a daycare while they even think about working. So I am working on addressing that, how we can alleviate some of these occupational licensing regulations and how that will impact the professions of multiple women across the United States. And me and my colleagues' work from the NEE Center has successfully able to address some of these occupational licensing regulations in some of the states in USA, and our effort is still ongoing. Thank you.
Thank you. Thank you. That's something that clearly, impacts tens of thousands of women, throughout within their careers. Let's see, Amelia.
Yes, thank you, Gloria. Also very excited to be here, and I want to thank AAUW for this opportunity to talk about these relevant topics, and also for the support provided to me throughout which was crucial for my dissertation. I'll be showing you a little bit of that today. So I think, well, my work relates primarily to trying to connect or assess what is the contribution of this unequal distribution of caregiving in the family to the disparities that we observe in the labor market between men and women. So I think in that sense, my answer to this question is very much in line with what Nell and Sriparna had already mentioned, especially in social sciences and particularly within economics, which is where I've been trained. I think there's been a long tradition of looking for answers to explain gender disparities in employment and earnings, for example, in differences in women's, human capital accumulation or aspirations, how ambitious they are, their preferences, and things like that. And I think in the last couple of decades, there's been quite a substantial convergence in some of those outcomes. For example, we know that women now in many places are even more educated than men, but still we see these very persistent disparities in terms of employment and earnings. So I think that has really changed where people are looking for an answer to this, which is something that women and a lot of communities have been pointing to for a long time, but hasn't really received that much attention from academia, especially for some parts of this work. And so I think in this case, usually the evidence that we have, especially in recent years, really points to the unequal distribution of caregiving, and particularly the lack of a sound infrastructure around care as the main obstacle that women today face to have higher attachment to the labor market and being able to be more successful in paid employment. So I think really, putting in place policies that can really diminish both the amount of work that families need to manage, especially those populations that have fewer resources to, cover childcare or the care that elderly population needs, that we know that is also something that is on the rise because of the current demographic changes. And at the same time, also favor a more equal distribution between men and women are definitely the key policies that we need to be able to see some convergence in the labor market outcomes of men and women in the coming decades.
Thank you so much, Amelia. And so when you're considering all of these sort of major issues that have already been brought to light, what do you see as the biggest challenge for advancing women's success in the current workforce? Let's start with you now.
Again, to speak quite generally, I would say, and I think we're all touching on, the lack of political and policy support for care and care laborers in the U.S. And for me, I tend to sort of draw the lens up again to political culture, and it would be the inability on the part of American political culture to view well-being for children, the ill, the elderly, and really for everyone, right? We all need care at some point in our lives as a top collective public and policy concern. We so often see it as a private concern. That's the way it's cast in our culture. In the past 50 years or so, we've seen many powerful efforts on the part of women toward building greater public support for care policy, from childcare policy, as we've talked about, and to support for care workers has happened for decades. And then we often see backlash against it politically. And since the New Deal, we've seen this erosion in general of social support for social supports, in a sense, erosion, particularly social supports for poor and working class women. So I think just energizing, I think one huge question for me in our current moment is how to shift that kind of ideological environment we're in. We see these efforts to improve care policy, and we always bump up against sort of ideological resistance, and it seems so entrenched right now. And so the question is sort of how to get it that current in our political and policy landscape.
Thank you. That's a great perspective. What about you, Sriparna?
So this is a huge question with multiple answers, but I am going to limit my answer into two bigger aspects. One is from the regulatory side, which I specialize on, which higher regulatory burden to enter, which acts as a barrier to enter the workforce. And that involves the lack of reciprocity of occupational licensing across states. And that also includes the higher cost of healthcare access for throughout the across the states, and especially in the rural areas, which I will throw in some light later on. And secondly, there is a higher unequal socio-cultural burden which the woman faces in terms of entering the workforce, and also in terms of caregiving, where they spend multiple hours. They are identified as the major caregiver even till date. So the answer lies in this bigger aspect of the regulatory and the socio-cultural aspect of creating barrier towards accessing and maintaining the workforce for women. Thank you.
Thank you. And Emilia?
Yes. I just want to complement what had just been said. Nell spoke about usually what are like the political barriers to this, and when working in these topics, and especially working, for example, in my case with the Chilean government on the design of policies associated to care, you really see that the first thing is that we know that for a long time the social benefits of unpaid care impact, we all benefit from it, right? And we know that care is very much a part of life, but we have, under the current organization of care, the costs that are also very high are borne privately by families, and that we know that within families by women. So we are currently in this particular system in that we have something that we're already benefiting from, but the costs are all borne by a particular group in our society. And I think I was thinking about this as Nell was speaking. There are tremendous, I think, obstacles politically to design really these care systems that really required huge investments in care, right? When there are different ways to value, for example, what is the contribution that women make to the economy through their informal care. When we see that in every country, across different continents and different areas, pretty much unpaid care is the main driver of our economies, but still is something that is not recognized. So I think there's a lot of things to keep in mind here in terms of like, what are the cultural notions that we have around care? What are the motives of that? How we can basically move to a society that values care, both informally, but also in the labor market. We know that even when care is provided formally, mostly by women, this is still heavily undervalued. And usually care workers also face a good number of restrictions. So I think in that case, really emphasizing how relevant this is and the value that it has to our society across many aspects is really key to be able to push policies that can really develop sound systems of care.
Great, thank you. And we're going to continue on this conversation around unpaid care. Emilia, if you can tell us a little bit more about your research on unpaid care work in Latin America, and how do the disparities in the distribution of care work translate into the labor market?
Yes, thank you. So usually my work and the work of other scholars working in these topics that I'll be also borrowing today, and that relates to this graph that I'll explain in a second, address this question as the question that we try to answer is, how does unpaid care or caregiving affect, let's say, for example, the employment of earnings of people who are providing care, how does unpaid care in that sense shape the labor market trajectories? And very crucial to that is to understand if this relationship between caregiving and the labor market is similar or not between men and women. So just to provide very quickly a little bit of framework to that, usually when we think about unpaid care, even though we know that care is a very diverse activities, different people, different families might require different types of cares and support associated to that, we usually think about two big groups, right? One would be the care provided to children or child rearing, and the second one would be the care provided to either elderly or sick population, even though care we know that is much more of a continuum across life. And something that we know that is a known fact is that women, especially, for example, in the Latin American context, are the ones providing the majority of care, both to children, but also to the elderly population. There are estimates of this. For example, we know that women provide at least twice as much time to children as that provided by men. And in most places, these disparities are even larger than that. And when we focus, for example, of people who are caregivers for elderly population, of individuals who have chronic illnesses and require constant care, usually information coming from surveys on these topics shows that at least 75% of informal caregivers are women. Usually also women are more likely, for example, to be the primary caregivers and provide even more hours of care on average than male caregivers. So we overall know, and Latin America in that is a region that is particularly characterized by wide gender disparities in the provision of unpaid care. So with that in mind, the fact that women provide the majority of care is not really enough to claim that unpaid care is one of the causes or one of the main barriers that women face in the labor market. Although I am going into that direction, but for example, to borrow the example that Gloria provided at the beginning that we've already used, another story might be, we might claim that if we believe that women are less ambitious than men, for example, in that case, women could have, less attachment to the labor market, more available time to provide unpaid care. And in that case, this, unequal distribution of caregiving would be more a result or an outcome of these differences in aspirations, in ambitions, than a cause of that. This, explanation might sound a little out of touch with reality for many people, especially those who have experience trying to balance paid employment and unpaid care, or who have seen family members in that struggle. But for example, from economics, for a long time, the differences that we observe in the labor market between men and women have tried to be rationalized through these differences in either what people call, behaviors, preferences, and things like that. And I think this is something important to keep in mind, because when we think that that is the cause behind gender disparities become less of a problem, right? It's not something that requires so much attention. So usually what my work does, and that of other people working on these topics, to really try to answer, what is the contribution of unpaid caregiving to gender disparities in the labor market, tries to analyze basically how, for example, the employment of both men and women changes after care needs arise in a particular circumstance. So that relates to the first graph that I'm showing you here. And this relates to the first type of care that we think about, so care provided to children. So this is from Cleveland and other co-authors, but basically these figures have become relatively, let's say, we encounter this type of graphs, I think, in different settings. What we're basically taking a look at here is we see the evolution of employment, or the difference in employment between women who have and do not have children, and between men who have and do not have children. And we see how that changes with the arrival of the first child, which is when we think that care needs associated to children really start. And just very quickly, basically we see that, being a parent has no impact on men's labor market trajectories. Their employment remains pretty much the same. But with women, the story is very different from that, right? We see that women pay very large negative consequences in terms of their employment when they become mothers. And also something that is very relevant and also very closely to some of the things that Gloria, you mentioned in the introduction, we know that these effects are very long lasting. Even 10 years after that, we still see this gap. And we know that that has effects that even go beyond that when we think about the accumulation of wealth or retirement, for example. And can we take a look at the next slide then? Great, thank you. And this is now coming from my own work. So this is trying to do basically the same exercise, but now focused at this second group of care, the care provided to elderly or sick population that I want to emphasize. And I think in this case, Latin America is actually a very interesting region to study because it is a region that is currently aging very rapidly. Chile particularly is facing a very rapid process of population aging, but there's really no infrastructure in place to address these needs. Chile, for example, spends something like 0.2% of its GDP on long-term care. So it's virtually non-existent. That means that all the care provided to elderly population that we know is expected to increase in the coming years really falls privately on the shoulders of families. And basically what this graph and my work shows is that, especially when that is the case, we can really see that care needs associated to the aging of the population are falling mostly on women and are in fact widening the disparities that we observe in the labor market. So basically what I'm doing here, because with the care provided to the elderly population is a little bit more challenging to define when care starts, I'm going to be using, just to be able to show this very clearly, in my work, I use cancer as a case of study. So what these graphs are actually showing is something like this. I'm focusing on working age population from Chile, so both men and women who are between 30 and 60 years of age. And then I'm going to see what happens to their employment and their earnings when one of their parents has a cancer diagnosis, because we know that cancer is a very prevalent disease that is also expected to keep increasing in the coming decades. And it's associated usually to a sharp increase in the amount of care that a person requires. And basically what we see here, very similar to the figures that I just showed you for children, once that when a parent becomes ill with a chronic illness that requires care, we see this very clear decrease in the employment rate and the annual earnings of the working age daughters, but we do not see any negative consequences for men. And again, these negative effects are very persistent for a number of years, which really speaks that when families are confronted with the need to provide care, and especially when they don't have any support or resources from the government or policies in place to do this, this translates into an unequal distribution of caregiving within families and these negative consequences for women in the labor market. So in this case, this is a clear example of what you were mentioning, Gloria, of women being pulled away from the labor market associated to caregiving needs. And something important to keep in mind is that we also know that these effects are even larger, for example, when we focus on population who have fewer resources. There are some families that might be able, for example, to pay for formal care, but the vast majority of families, not only in Latin America, also, for example, in the US, when they're not able to do this, we see that the negative consequences of caregiving are even larger. And we can really, in this sense, we can really claim from this that unpaid care is widening gender disparities. And I think this is something to keep in mind when we think about, for example, the current demographic trends that we're facing in the current time.
Thank you. So in your academic career, you've collaborated closely with policymakers to address gender inequalities in labor markets. So what do you see as the role of partnerships between academia and policymakers in driving progress?
Yeah, I think the collaboration between academia and policymakers is really crucial in these topics because we see that many times, well, first, the policy answer to these questions is not obvious, right? We can sort of see what is the direction that we want to go. For example, we know that we need policies like paid leave. We need basically policies that help people, on one hand, reduce the amount of care that they have to handle. So that means either public provision, subsidies, and things like that. But at the same time, we also need to improve how people can balance their paid employment with the provision of care, because as we've said, care is a part of life. I think in that case, academics can really be a relevant contribution, because sometimes policies designed for this end up really not having the intended effects. So for one example, coming from Chile, a few years ago, because there was concern with the fact that mothers were usually the ones who were providing all the care to children, we had only a maternity leave for women, but not for men. When the parental leave was also implemented for men, but in a voluntary way, even today, there's like less than 1% of fathers actually take this benefit. So that's kind of like one example of a policy that, even though it had sort of like good intentions in mind into making care more equal between men and women, that ended up not being the case. So I think having good sort of like empirical work, evaluations, and also collaborations with policymakers, it's very important to be able to really assess the effects of how effective are different policies, but also how policies can be really implemented in practice. And I think one last thing is that not only having, let's say, policymakers, academics, but also having representation of, important organizations, in this case, for example, organizations of caregivers, is really important, because caregivers are really the ones who know what kind of support they need. And that's also something very important to keep in mind when we design policies.
Absolutely. And thank you for highlighting the childcare issues and what happens, once someone becomes a mother in the workplace in Latin America, and looking at those sobering statistics, here in the United States, there is exactly sort of a parallel thing that happens to women here. We call it the motherhood penalty. And what happens to women, but also there is research has determined that there's an actual fatherhood bonus, that men actually it has a positive impact on men, and it has a negative impact on women. And so unfortunately, that's something that happens, across the world, that women are penalized, and it has a very negative impact on their ability to often be successful in the workplace. So thank you. And so talking about how collaborating with policymakers as well. So they obviously would be a stakeholder, right? That would be involved in helping to really reduce many of the disparities that you talked about. So how else can we work to eliminate those disparities and support women in the workforce?
I think here I want to go back to the point that I think Nell made at the beginning. It's like the work that I just showed you, just very shortly, it's something that basically it happened as a collaboration with the Chilean government, particularly the ministry, who is currently trying to design what they call a national care system, precisely to address these kind of disparities. When we met, for example, to discuss the findings and what are the policy recommendations associated to these, one of the main things that we would hear from policymakers was like, this is very expensive, to allow people to be absent, for example, for work for a whole year, if their parents, for example, need end-of-life care or things associated to that. At least in the short term, these policies definitely require very, very relevant investments. And as Nell said, when things are going well, people will say, we want to, invest in care, in the care infrastructure. But when, for whatever reason, there are pushes towards budget constraints, I think care is definitely one of the first things to be sort of like eliminated from what are the priorities. So I think in that case, having, policymakers that are invested in this, but also representation, for example, of people providing care, that we know that it's, a relevant share of the population, is very important to keep in mind that this is really a key issue, and that it can lead to very important goals, both in terms of like how the economy works, but also in terms of equality when we think about more of a medium or long-term goals. So I think in that case, designing these policies, not only academics, policymakers, caregivers, but also private sector is very important that is involved. I think this is really a conversation where everyone needs to have a seat at the table so we can figure out really what is the best way to push this forward.
Absolutely. Thank you so much, Amelia. That's a really great point to end on. It really does require the collaboration of so many different individuals and sectors in order to really have a solution that can be effective and long lasting and that can actually have an impact. People can't be siloed in their different areas. That collaboration really is important. So thank you for your thoughtful insight. So now I want to move to Nell, and I let us hear a little bit more about your work on the gendered and racialized history of the cultural politics of care in the United States, and sort of also what does the landscape look like today?
Unmute. Thanks, Amelia, so much for that those interesting remarks. Although my research is in many ways so different, I think it's kind of, as you said earlier, sort of a wonderful complement because of this issue of our priorities, right? And the fact that, yes, there is an investment that needs to be made, and but it's so much a matter of priorities certainly in the case of the United States, a wealthy nation. And so my work, I think what contributes to this conversation is the way that it can sort of denaturalize the pressures that women face to be the primary, providers of care, whether it's elder care or childcare, and those disparities, to sort of denaturalize what we often feel is our natural role, and in part by looking at the history. So I'm interested in how American political culture has maintained these sort of social hierarchies within the realm of care and care labors. And I call this dynamic the care hierarchy. And it's multifaceted, has to do with obviously gender, that's very clear, but it also has to do in American life with race. So there's this ongoing political struggle over this hierarchy that has carried through history and that persists today. So an example is historically, in the way that it has shaped current politics, is like the early 20th century, the progressive era, when white middle class and upper class women's care, their sort of loving care for children, their procreation, their actual production of children, was valorized, not just, both to a good society, but also to explicitly the advancement of the white race. And they were defined also historically in opposition to women of color. They were sort of elevated in relation to subjugated women of color. Women of color, particularly Black women, who were vilified for their care of children in terms of their own care, their own motherhood. If you think of the enduring or certainly familiar stereotypes of the welfare mom, the poor, just sort of stereotypes around women of color's poverty, the crack addicted mothers in the 1980s was this huge issue in the media. So you have that kind of vilification, and at the same time of Black motherhood, and at the same time you have this expectation throughout American history of a kind of nurturing, subservient care by women of color for white families. So, and if you can think of the stereotype of like the Black mammy or the loving immigrant woman who's brought sort of third world values of love to stressed out white middle class families. So struggle over these disparities kind of there's this thread that I see throughout American history, and it persists, I would argue, in today's politics. Even though, and I want to be clear, I'm not saying that change doesn't happen, that we don't make progress, but it's kind of this ongoing struggle. So one example I look at in my current project is Amy Coney Barrett's hearings in the Senate for her Supreme Court nomination. She, of course, is now Supreme Court Justice. And how, in those hearings, she used her motherhood to political ends, and so did her supporters. She was this public figure. Her seven children were seated in the hearing room. She presented herself as a sort of pious, poised, and maternal. And then, of course, went on to be a key figure in the overturning of Roe v. Wade and the Dobbs decision, which in turn severely eroded women's access to reproductive health and abortion care, which in turn blocks women's access to the workplace, to their work goals, and this decision has been found to affect, in particular, women of color's access to reproductive care. So it's a highly complex landscape that I kind of use this sort of blanket term, the care hierarchy. It both has to do with who is expected to care and in what ways, and who gets elevated for their care, and also who has access to care. I think it's very intertwined. So again, I want to be clear that progress gets made throughout history, and then there is so often pushback. And I do think today we are seeing renewed backlash, and I'll just speak frankly, in the sort of authoritarian politics of Trumpism. I think that is in part an effort to push back against women's efforts over decades to dismantle the care hierarchy. And there are, strong forces in American politics who want to maintain it. So that would be what I have to say in response to that question.
Okay, and so you elaborated a bit around the care hierarchy, and can you talk a bit more about the true impact, right, that it really has in women's ongoing participation in the workforce? You mentioned how it has, obviously greater impact, disproportionate impact on women of color, but in general, like, how is it impacting women's ongoing participation in the workforce?
Right. So I think as long as, well, it's tricky, isn't it? Because because care is gendered. It's culturally gendered. There's also a biological aspect to it. People with uteruses give birth, but I think as long as we gender it beyond that, there are headwinds. So gendering is part of the care hierarchy, that women are expected to take on the care burden, men less so, as Amelia's slides showed. And then within that, you have these sort of racialized roles, some of which are more subjugated and some less. And so I think in terms of access, in terms of participation in the workforce, for one thing, this care hierarchy affects the sorts of jobs that different women are expected to get sort of channeled into, which relates to Shriparna's work, and how much mobility those jobs have, how much mobility those women are expected to have, encouraged to have, etc. So it's this way that cultural expectations shape the amount of the ability of women to pursue their goals, both, career and economic. Yeah, thank you.
Absolutely, thank you. And so you're currently working on a new book project, right? Entitled Mother, Nurse, Housewife, Maid: How Figures of Care Shape American Politics. And it explores those 4 gender racialized figures of care. Tell us a bit more about your findings so far and why we should be approaching this issue through a lens of care justice.
Yeah. Well, so my example of Amy Coney Barrett is one example from this project. And she would be a mother figure of care. And I really see the mother as kind of foundational to all these other figures of the nurse, the housewife, and the maid, in that the mother is kind of foundational to the way we perceive women's care. And the reason I have sort of organized my analysis through these 4 figures is because I started to see them as like creating the care hierarchy. We don't really, we so often don't think of care as just this abstract, right? It's something that women do in roles. And so these roles have defined in both gender and racial terms who is obligated to care for others and whose care labors are valued, as I've said. So I'm tracing a history of each of these figures. And I say figure, you could say role, you could say almost icon. It's like this recognizable role or figure that we see and that shows up in popular culture. So I trace a history of each of these figures, generally from the early 20th century to today, and showing how struggles over care labors are so related to how we portray and see these figures. And I use the concept of care justice as a way of joining what I see as concern for care in America as a kind of a moral value with concern for justice and equity. And sometimes it can almost feel as if those 2 concepts are in competition. And I think that's been something of a challenge for feminists really since the second wave. Justice, that word might speak more to sense of rights, access, equity, a more public sense, right? And it might be more associated with fight, struggle, demanding rights. Whereas care, when we think about it, it speaks more to the private, to say creating a loving home, caring for children and parents. And I got interested in this tension between those 2 values and why is there this tension? And I thought, so I can think of something called care justice, which is really joining those 2 sort of ideologically. And it would mean promoting that kind of public, collective sense of responsibility for care that I think is missing so often in American society. So for instance, an example of the ways that we kind of make progress and then we lose it. And it would be that moment in 2022 when Biden's Build Back Better program, there was this big care support policy in that set of bills. And in the end, all Republicans were against it. And in the end, a lot of it passed, but most of the care provisions did not pass because of one senator and all Republicans. And as Amelia spoke to earlier, like it's a question of sort of priorities. And in that case, it was care that fell off the legislative agenda. So I think by promoting this sense of care justice, joining that sense of rights to our concern for care could help us to make progress in this area.
So true. Thank you. Thank you for that insight. And, AAUW has, been a constant advocate, I think, for all of these kinds of policies. And, when you know that there are policies that are going to make a transformational difference in the lives of women and girls, and you see them sort of still taking years or decades to get across the finish line, it does just in so many ways just make you want to work even harder and, to press legislators even harder and to hold those who are currently in office even more accountable for making sure that they do keep their promises of what they said that they were going to be doing, once they were elected, because we know that very often once people, do get that seat that they were aiming for, then sometimes they actually don't keep the promises that they were running on and that they were utilizing in order to get, women in particular to vote for them. Thank you very much. Interesting research. I am interested in, and I'm sure many of our participants are interested in learning more about the new book that you are working on. And so make sure you let us know when it is released so we can share that information with everyone. Thank you so much now. All right, so now we're going to move on to Shurpana. So another aspect of this important topic of conversation, we want to start by, let's see, first of all, thinking about, how do health outcomes impact access or barriers within the labor markets, particularly for women and underserved communities? And also, the theme really around the CSW 68 this year around social protection systems. So how can strengthened social protection systems improve outcomes? And really, how would this impact the women's labor force participation?
Thank you so much. And I wanted to also take a moment to recognize the effort made by AAUW to bring all these women and especially supporting me with scholarship as a young researcher. So, as an economist, people always expect me to focus on the monetary aspect. So here you go. I am starting with the wages, gender wage gap. So the female to male gender earning ratio has improved a lot. From 1985 to 2020, it has gone up from 68% to 81% using data from current population survey and US Bureau of Labor Statistics, but we can still identify some of the factors for the gender, for the wage gap. So I'm going to talk about some of them in today's, in the few minutes I have. So if we could go to the next slide, please. Yeah, so on the slide, you will see that these are the topics which people have researched on a lot, which are creating the gender gap between male and female. So there are gender-based occupational segregation, of course. There are occupations which are male dominated, but honestly, I will use some of these examples that even in female dominated occupations, right, we still see this gender wage inequality. So I am going to focus on these two aspects. If you see the last two bullet points on this, on these two aspects mainly, which really creates a lot of this gap. One is childbirth. Honestly, there are different healthcare access aspects which creates the gender wage gap. But for this few minutes I am going to focus on childbirth. And then another aspect which is related to my own research, that is the occupational licensing regulation. I'm going to use that to explain how when the family moves from one state to another, and what we call is trailing wife, how they get affected by this migration of the family from state to state. If we could go to the next slide, please. So the research has already focused on, and Emilia and Neil, they have, especially Emilia's thesis is really focusing on the unpaid work, and also Neil also talked a lot about how women experience a higher burden of caregiving, and domestic tasks. So we see that in France and Germany and in many other developed countries, there are already maternity leaves and paid week offs for spending with the child. But recently, though, US has passed 12 weeks of job protected leave as a federal requirement. But in addition to that, the states have started to give the paid maternity leave after childbirth. So while I was researching this, I found that there has not been a lot of research. So this is going to be adding to my research agenda to look at how this different maternity leave requirements by the states is affecting the hours of work for women post childbirth. So we can see that at this point, in 2023, we have 13 states and District of Columbia who offers paid family leave after childbirth. So there is this gender discrimination still, and there has been ongoing effort to address that gap. And I haven't seen a lot of empirical work. If you all know, please direct me towards it. Otherwise, I am going to keep focusing on looking at the effect so that we can advocate for other states joining the league. If we could go to the next slide, please. So, as I mentioned that, the families move due to different reasons. I have especially done a little bit of research on the military family movement. So the military families move from state to state more often than civilians. But what we are really focusing on here, that migration of families tends to harm the employment and earnings of married women. And 20%, 25% of the workers in US are in licensed, regulated professions. And these licensing requirements disproportionately impact women twice compared to men, because not only they, as I have given you a snapshot, the women are in a lot of these professions which are heavily burdened by licensing requirements, and they also get affected by consumers because, as Neil and Emilia mentioned, that even till date, the women is considered to be the primary caregiver. So there is always a higher opportunity cost. Should I leave my child with the high the daycare which charges me this high cost every month, or should I be just taking a leave from my work and continue to be the caregiver? And after having a child, if I move to another state, do I have the time to just get pass the exams again to acquire my licensing when I move from state to state? So these are like being trailing spouse. These are one of the barriers, huge barriers women face. So if we could go to the next slide, I am going to show you that how ongoing research is focusing on addressing these barriers. So there are few professions which we see that are currently dominated by women, and nurse practitioners is one of those professions which we see that have majority women. Sadly enough, though, just quick note that we still see gender inequality in nursing profession, with male getting more earning than women. Anyway, so scope of practice laws and labor market regulations have supported that extension of this licensing. So what do I mean by that? That means that some states have agreed to do accept compacts, nurse licensure compact, interstate licensure compact. So if I have a valid license in New York, if I go to New Jersey, I would be able to practice if I am in a good standing with New York. Okay, so my current research and my colleagues' research show that this has actually increased the labor work hours and the mobility for women. And currently, I am also focusing on that how this expansion will affect maternal health in underserved communities. So more coming soon.
Great, thank you, thank you. And I think it's important to elevate an issue like licensing and regulation because, it is a topic that, for the most part, I think, like the average person doesn't know a whole lot about, and certainly don't know a lot about the impact that it has on women's participation, labor participation in the workforce. So I think that's really key. So thank you for that research. And so, in thinking about that, also, we've talked a bit about the impact of legislation and advancing progress in the workplace, but can you talk a bit about the impact of legislation and advancing progress on women's health outcomes and their participation in the workforce? And sort of how have you seen that through your work in the US?
Yes, it is very important to talk about that. So I am going to, so there is a lot of discrimination women face, and now I'm going to talk about a little bit about women of color. And I have done research on immigrants women, but that's for another day. So here I am doing a bit of research on my state of residence, that is Ohio. So we see that, especially if I focus on my own research, that's breast cancer, women with a history of breast cancer miss a lot of work days. And you can see that 66% versus 50% among younger women, 54 to 47% among midwife life women. So 40% of Black women are the mortality rate for Black women from breast cancer is 40% higher than white women. And it is alarming, and it is really, really scary that how the Black women and Latina women, this is one of the biggest cause of death, and they are 10% more likely to die from it than non-Hispanic white women. Okay, so what is one of the bigger cause that why Black women are really prone to get diagnosed later stage in uh, uh, breast cancer compared to white women? So there are multiple causes behind that, but they face a lot of disparity in terms of care. in terms of regular screening, so we see that physicians, they are less likely to refer Black women and Latino women for screening compared to white women. And we know that there are different state laws which make it impossible for women to get screening early in their life. Okay, I think in Ohio, the cutoff was 40 years before you can even get your scheduled screening done. So if we could go to the next slide. So I am working right now on identifying the socioeconomic factors which act as barriers for early detection of cancers, and mainly breast cancer in Black women. And recently, House Bill 371 has passed in Ohio, which eliminates that age restriction and also does the coverage for annual mammogram, and if they need further screening, because I know my research says that Black women are more tend to get heavier breast tissue, which is not going to be identified in the initial screening. So they need more testing, which is, again, they don't get referred to that. So House Bill HB 371 is going to make it easier in terms of insurance coverage and early referral for the screening. So my current research is focusing on the impact of race and other factors, including insurance coverage, on the 40-year and older patients, Black patients with breast cancer compared to white patients, and how that plays a role in terms of their survival, and also the efficacy of this HB 371 in terms of improving the survival of the Black patients. I'm using hospital data from Ohio. So fingers crossed, hopefully we'll make more changes soon. Thank you.
That's great. Thank you so much, Riparna. And I think that, it's important to elevate something as critical as breast cancer, right? And the impact that, not just cancer, but so many other health conditions have on the women and their careers, those who are disproportionately impacted. And we've talked a lot about, a number of factors during this discussion, right? And the importance of having these social protection systems in place, because whether you're talking about healthcare, whether you're talking about caregiving, or the unfortunate impact of, the motherhood penalty, all of these do require that policies be put in place so that the way in which it impacts women's labor force participation does not have such a debilitating effect. So I thank you all for the insights that you have provided, and also the information around, what's important in terms of stakeholders and legislation, and, who needs to be in the room, and the collaboration that needs to be done in order to actually, put laws in place, put services in place, and have funding available to actually have an impact on reducing so many of these inequities. So thank you all very much. So I wanted to think about a general question for you all, because we have touched on, just that urgent need to have strategies and solutions to really advance women's economic security and improve access to work-life policies. So what is the one thing that you feel could have a transformative impact on women in the workforce? I'll start with Nell.
Thanks, Gloria. I think because my first book was about elder care, I'm going to go with one but enormous challenge in terms of policy, but it would be to somehow implement a national federal system of long-term care, basically fold long-term care into Medicare, which does not currently cover, day-to-day long-term care for the elderly and chronically ill. This was something that got tried in the Affordable Care Act, in Obamacare, and they were unable to come up with a funding mechanism that would pass. But I think if we could somehow provide better support for that sort of, not the acute care that Medicare covers, but long-term support for care, that would be absolutely enormous for American workers
No,
and
absolutely.
American elders.
Yeah, life-changing for them, life-changing for their families, for sure. Emilia?
Yes, I mean, just connected. I think I'm going to cheat a little bit and build on Nell's answer. But I was also thinking with the presentation of Sriparna that it's really interesting how all of these points really coincide. For example, from my own research, we see that usually when cancer cases are diagnosed late in the disease, this also has a negative impact on families and caregivers because this usually translates into cases where people end up needing end-of-life care, which tends to be particularly intense, and in that case, particularly relevant when we take a look at these sort of like negative consequences on the labor market outcomes of caregivers. So there's also, I think, like an argument to be made there that improving, women's access, or not only women's, but overall, the access that different populations have to preventive care or care that can really identify diseases or illnesses early are also policies that can help to achieve gender equality in different aspects. So I think that usually also serves purpose of really showing how these policies can have benefits in different dimensions, some of these that are not evident when we first think about these things. And I think related to that, really what's key is really having systems that provide care. So as Nell was saying, not only care, like when you talk about caregivers, or I think something that is also interesting about this issue, when in my own research, a lot of times where I present these figures, people come to me with their own stories, because this is something that most families experience in one way or the other at different moments in times, right? And there are a lot of caregivers, mostly women, for example, people who are taking care of family members who have dementia, that it's really a 24-hour job, right? You can't be absent from that at any point in time. So really having support from policies, even to have, for example, a day off and to be able to, do whatever you need with that time to get medical care, right? To take care of administrative issues is something that is really life-changing for caregivers. And I'll just add to that I think because of that, it's really important to include caregivers in the design of these policies. For example, lately in economics, there's research showing that just the provision of childcare doesn't have sort of like the positive impacts on females' employment that people might expect. And there's a lot of discussion that really has to do with that a lot of the times, for example, childcare functions with schedules that do not really align with the schedule of the workplace. So really having in mind, like providing policies that actually fit into caregivers' lives and how they usually operate is really crucial to have policies that are effective at making improvements in these topics.
Yeah, that's a really great point. And someone who is the mother of 3 children, raising them and working full time, and, childcare and summer camp and everything, getting it all to align was always an exercise in trying to balance the imbalance, because, the hours never lined up the way you want them to line up, unfortunately, for sure. Thank you, Amelia. Sriparna?
What I have found in my own research is that the role of community is huge in terms and transformative in terms of changing the policy. So all the policies I talked about has noticed a transformative role in terms of the local community advocating for this problem. So for this project in breast cancer, I am actually co-designing this intervention where we are going to educate the local community, the targeted breast cancer patients, with the with the importance of regular screening done. So where I am going with this is that the to give the platform to collaborate between the policymakers and the community and the researchers, to bring everyone together so that we can get like a full picture, is extremely important, which we have mentioned multiple times in this platform. And really, the accountability and seeing the flexibility of the, so we have the work from home option for many jobs right now, not only for women, just also for overall, just incorporating and the paid parental leave and offering the flexibility and humanitarian aspect towards equally treating men and women is extremely important in terms of increasing the efficiency of the workforce, and just have like a better psychological environment for women to work.
Absolutely, thank you. And building on that, when you mentioned, the importance of the community and outreach to the community and mobilizing the community, I want to ask you all, what action can we inspire those who are attending this webinar today to take in their own workplaces or in their own communities? Start with Emilia.
Yes, when studying caregiving, this from economics, I remember something that really stuck with me was the idea that care is not something that only happens in families. We need to be thinking about care as something that can also, have a place in, in our jobs, in our communities, in universities. So I think that really changes sometimes the narrative or the idea that we have in mind related to care as something that is strictly private, like something that you do once you go into your house, but once you leave in the morning to go to work or go to school, it ends and just stays there. So I think emphasizing that we all, care and will need care in, different organizations and dimensions of our lives is really something that can help push to figure out, for example, what policies do we need in universities to support people who require care, but also people who are caregivers. And I think that has opened, for example, in my own experience from Chilean universities, that has definitely helped to, in the last couple of years, have childcare provided to students who are mothers and also students who are fathers. And I think similar points can be made when we think about, different types of workplace arrangements. So really having that perspective, I think, wherever we are is something important.
Great. Now, any one action that folks who are participating can think about taking in their own workplaces or their community?
Yeah, I think I'll build on Emilia's comments and say, it's here at Brown University, it's been just interesting to see in the last couple of years the rise in formal labor organizing among students, first graduate students and now undergraduates, and to see actually the increased union activity across the country. So don't know that I'm going to say organize, a union at your workplace, but I do think just a sense of solidarity can be a form of care, as Amelia is talking about in a workplace, building a sense of solidarity in your workplace, whether, sharing your own care burdens, asking about others, problem solving, talking about, how policies might change in your own workplace, and coming together to perhaps, in a kind of solidarity way, make change.
Great, thank you. And one action, Shriparna?
So it's unimaginable what one story can do. All these laws I have talked about is an outcome of different stories the lawmakers heard, the different stories the researchers were able to turn into articles and publications. All these numbers are your stories. So, you have to raise your voice. You have to make, focus groups. You have to build your own safe zone, your own community, so that you can make changes. In order to be helped, you have to help yourself. Okay. So raise your voice, make your group. I mean, AAUW is doing such a great job in bringing and making groups. And, as an immigrant, an woman of color, I have made a lot of friends and collaborators across AAUW. So it's very important for your voice to be heard. You are important, and you know that.
Great. Thank you so much, Nell, Amelia, and Shriparna. I want to thank all of our incredible panelists for really sharing your valuable insight, your knowledge, and of course your time this afternoon, because everyone's time is valuable. Just another reminder, the recording will be posted on our website in the next week or so. I want to thank the AAUW staff who participated. Also want to thank the NGO Committee on the Status of Women in New York for supporting our parallel event as part of the UN Commission on the Status of Women. I really hope that today's conversation has left all of you who participated with, some opportunities for action and really, some renewed hope that we can and we will achieve a more just and equitable world for all. Women are not less ambitious, but we see that we need these social protections in place in order to advance women's success. Thank you again for our panelists. We are really also proud to have you a part of AAUW's Fellowships and Grants community. I encourage anyone who can, if it's suitable for you, to become an AAUW 2-minute activist. It really allows you to take timely action on issues impacting women and girls when your advocacy is needed the most. And trust me, your advocacy is needed now. So definitely visit our website at aauw.org. You can sign up, you can learn more about our research, about our advocacy, and about the training and other opportunities that AAUW is working on to advance women's economic security. And I will close just with these remarks from the UN Women's Executive Director, Seema Bahos, during the opening of the CSW 68, because they really struck a chord with me. Quote, "The struggle for gender equality is not new. Women have been fighting for their rights for centuries. History is replete with heroes, women, as well as enlightened men who laid out a path for us to follow, who exemplified sacrifice for our cause, and who modeled the courage and wisdom we need today more than ever. We stand on their shoulders, and we owe it to them to keep the fight going until true equality in social, economic, and political life is attained. We aspire to leave a mark on history as they have done," end quote. And so I ask each one of you to consider, what mark do you want to leave behind? Again, thank you so much for joining us.